Well, hello and welcome to all of our gold participants from around the world. I'm Fiona Lang-Sharp, IBCLC and Director of Communications here at Gold Learning. Well, here we are getting ready for one of our great conferences coming up. I'm so excited. Our Gold Obstetrics and Gynecology Online Conference 2019. And I'm sitting down with Dr. Pamela Berens today. She is going to be speaking at this conference. As you can see, if you're looking at your screens right now, you'll see that her topic is titled Making Cesarean Delivery Family Focused, and we're going to chat with her in just a moment. Quick reminder of how to get in touch with us. I know you don't want to miss out on this conference, our inaugural year here, and we've got some exciting things coming up for you at the conference. It opens up on November 4th with our opening keynote, Dr. Neil Shah. So everyone will be able to come and join that. That's a free and open access presentation. And so I certainly want to see all of you there. It's really super easy to register to. You just need to go to our website at goldobgyn.com. Registration is open for the full conference. And so we'll look forward to seeing you all there. If you have any questions about the conference, you can certainly email us at team@goldlearning.com, and we'll look forward to hearing from you. Well, without further ado, please welcome Dr. Pamela Berens. It's great to have you here today, Pamela. Welcome to Gold.
It's my pleasure to be here. I'm so excited to participate.
Oh, well, I'm very happy that you're here. This topic has to be by far one of the things that I love to talk about ever since first learning about the practice of gentle cesarean or family focused cesarean, and the fact that you and I are both IBCLCs and we have those things in common. We have some of those common goals, in order to make sure that we can have those babies attached at the breast early and often. But first of all, I really wanted to ask you, I want to ask you something about your life, Pamela. I want to know where you are, what it looks like for you on a day-to-day. What are you doing? Are you teaching, working in a hospital? Perhaps you could share that with our audience that are listening right now.
So I am lucky enough that I get to do a little bit of a lot of things, and I really, really enjoy that. So I am down here in Houston, Texas, so it's rather warm for us still.
Yes.
But I am actually a native from Minnesota and Iowa, so I'm much more used to the snow. So.
Ah.
I did my training at the University of Texas and was fortunate enough that I got asked to stay on here. And so I do have a private practice that I've had for probably around 25 years,
Wow.
while I also teach. So like I say, a little bit of everything. So some of my days are spent doing private practice and taking care of my private patients. And some
Mhm.
of my days are spent taking care of the residents' patients, or I should say assisting the residents with taking care of their own patients and teaching them some of the skills, both medically and related to looking for their patient's best interest.
Oh, that's wonderful. And your experience in, teaching these days, you must have seen a lot of changes, I imagine, in your students and how they've really gravitated to this profession and some of the things that they're keen to learn. Do you find that there's lots of changes that happen? Has there been a big shift recently as we've taken another look at birth around the world and how that's changing again?
Yeah, it really the birthing processes, at least where I'm at, have changed really dramatically over the years. I
Mhm.
think that back when I had my first child, the child was separated from me for 4 hours, and I
Oh,
recall having to bargain to have the baby for the first hour before it was separated to go to the nursery for a
mhm.
mandatory transitioning period.
Sure.
So very fortunately, we've gotten rid of that. That was just so frustrating as a mother.
Mm.
And so now we really have focused much more on keeping our mothers and babies together if there is no medical reason to separate them. And I just think that is such a big win for everyone.
Is it a surprise to your students when you talk about some of the things that, and I'm the same generation as you, Pamela, in the terms my first baby also separated. And as you said, you had to bargain. I also had to do that too. I just remembered that. Get that baby out of the nursery on a different floor as well. I don't know if you had that too, but our babies were on a different floor to us. Do you find that your students are surprised by what happens, or do they think that it's okay to separate mothers and babies now? What's the real feel of these students coming in as you teach them?
I think that the students and the parents all now expect their babies to be with them.
Right.
It's just a very different environment. Yeah.
Ooh, yeah, wow. That climate really has shifted, which is good because, of course, you and I know better as well. And we're, here teaching students in different capacities, which is really exciting. I'm glad to hear that that's changed. And you mentioned the parents, like the consumer. We've been talking a lot about how the consumer has been sort of demanding more, or they're more knowledgeable. Partly, I'm sure, in the fact that we have, an internet service now that provides a lot of information. But it's also kept things fairly consistent, I think, in different hospitals. Is that something that you're noting as well?
Definitely. It really, our, I think many of our patients have much more of a voice now, speaking up for things that they would desire and asking really, really wonderful questions about
Mm,
why we do what we do.
right, right. I wanted to ask you too about your private practice. That must be lovely to work with, patients one on one, and so when they seek you out and they find out, I mean, you've got some wonderful credentials too. And we talked about you being an IBCLC as well. It must be just lovely that you can give them a bit of that continuum of care that we know is valuable to our clients and our patients. And so when you're talking about the different things when it comes to birth, do you get an opportunity to sort of speak about what's going to be really good, after the birth and long term for those infants who are, they're planning on breastfeeding?
Yeah, I do think it's really nice to have a background where I can assist with both.
Hmm.
I also am fortunate enough to work at a place where it was really realized that breastfeeding is part of obstetrics. And so we have not only myself, but we also have a lactation consultant that our patients are lucky enough that they can see. I realize that lactation consultants have often been in pediatric offices, but
Right.
it was rather progressive of us to have them in an obstetrical office.
Absolutely. No, that's really good. Okay, let's dive into I can't help it. I need to dive into this topic. So the topic that you're speaking about, just first of all, it warms my heart because for those of our clients who need or choose to have a cesarean delivery, what are we doing with them? Well, you can see that you've chosen the words family focused. We were talking offline, and I said, yeah, there's family centered care, there's gentle cesarean, all those types of things. When was it you first sort of started moving towards this in your work, that you felt that this was a sort of became a priority for you, Pamela?
So I guess I didn't realize that I was doing something specific
Right.
related to a gentle C-section or family focused. I do recall many, many years ago, probably one of my first years with my private practice, having a patient who had a rather large baby.
Okay.
And she had talked to me about having a trial of labor.
Mm-hmm.
And she actually did and failed and ended up with another C-section for, again, another rather large baby. And
Sure.
when she came back, she said, I really want more children, but I don't like the way my births go. And so
Mm,
we started to explore really what was it that she didn't particularly care for. And
mm-hmm.
and I was just trying to meet her needs. So I told her, I can't tell you that the trial of labor will work. I can't tell you that we can have a vaginal birth, but tell me what I can do to make this cesarean delivery the way you want it. And
Mm-hmm.
it was really very wonderful for her to explore her, I guess, how she emotionally felt about her experience and how she
Mm,
felt kind of gypped. I can't think of the better term
right.
for that, but
No, no, I
she
hear.
didn't, she felt cheated out of what she really wanted.
Sure.
And,
Yeah.
and that's really when I started to explore doing things a little differently in our cesareans so we could meet the needs of the patients to the best of our ability. Clearly, we
Mm,
can't make
right.
everything go the way they want,
No.
um, but many things we can, and we just have to alter what we do to try to put the family first.
Absolutely. Yeah, this is such an interesting topic because it comes out of our patients, feeling like they've missed out. Some of them have had, traumatic births too, where things have gone wrong, and that there's sort of a healing process. They want to have more children, but the fear of going through, an emergency again, can be very off-putting and sometimes to the point where they don't have any more children. But for those that are interested and come to us and really want to plan it out, this is definitely a great option. So I'm really curious to hear more about how you were able to, because you're not the only person in the room, obviously, when there's a cesarean birth happening. So how did you facilitate getting people on board? Or again, as you said, you didn't actually realize that maybe you were doing anything different, but talking about it out loud, obviously there's some conversations to be heard. How did your other colleagues in, different practice, how did they gravitate towards this style as well?
So I think that when we first did this, we were approaching people that we thought might be like-minded, that would be willing
Mm,
to work with us so far as
sure.
anesthesia and nursing and some of the doulas that I've worked with as well in trying to meet the patient's needs. And as
Right.
time has gone on, I think more people have kind of come around because it was so important to these women or these
Right.
families.
Yes, I can imagine. So I would imagine that people probably seek you out now because it gets around pretty quickly. I know in circles of parents about different physicians who practice different ways, which is lovely. And so do you have, like at your specific facility now, do you have a policy that talks about this per se, or is this something that you just have a mutual agreement on right now?
So yeah, it's mostly a mutual agreement right now. And again, I'm going to go over particular details during the prenatal care with her about
Mm.
things that she particularly wants for her birth.
Mm. Well, that's very exciting. That's great to hear. And I mean, I'm seeing a lot of this come up. The first time I had seen a gentle cesarean was from a UK facility. Just really expressing some of the concern. And I think does the outcome for the infant, are the infants more stable as well? Do they breastfeed better? What are the results when we sort of have this sort of focus, Pamela?
Well, I'm really hopeful that the infants actually do have better breastfeeding outcomes. There are a number of things that we know that a cesarean delivery can do that impact successful breastfeeding. I think that this is actually a topic that's been inadequately studied by science, so we need to apply more science. We need to see what happens when we get moms and babies together more quickly with cesarean delivery, if that does help with some of the things like the delay and when the milk comes in and different aspects to breastfeeding.
Yeah, well, that's wonderful. Well, there's an area if someone's listening in and they need to do some research, it's an opportunity is right here for those who are listening. So that's wonderful. Well, it's been so lovely chatting with you. I'm really looking forward to this particular presentation just because I know, there is a demand for this and, families are looking for alternatives in delivery and birth. And so it'll be great to hear how you're doing it and, just learn the aspects of what the outcomes have been for you personally and your team. So thank you so much for sharing a little bit about yourself and your life there as well.
Thank you so much for having me.
So you're welcome. Well, once again, we've had the pleasure of sitting down. So thank you so much, Dr. Pamela Berens, for being with us here today. And of course, again, to our listening audience, Dr. Berens will be with us for our obstetrician gynecologist online conference 2019. You can find out all the details online at www.goldobgyn.com. We'll look forward to seeing you on there. Thank you so much for listening. Bye bye for now, everyone.